Madam Deputy Speaker, in Hampshire and around the rest of the country, in 2019 and 2024, Conservative MPs stood on the promise of delivering new hospitals, including one for Hampshire, and it turned out there was never any funding, and it was just false promises to try and get votes. And I've fought tirelessly to save and improve Winchester's A&E and the consultant-led maternity. Now, with the announcement that the construction for a proposed new hospital in Hampshire won't even be started until between 2037 and 2039, we absolutely need to ensure that the current services are invested in and improved so that they do remain fit for purpose. Now, Madam Deputy Speaker, given that the new hospital programme is delayed, this means it is more urgent than ever to increase capacity by fixing social care, so that those who are well enough to leave hospital can be cared for in the community, thus freeing up beds immediately. Now, we cannot endure both insufficient social care packages and crumbling hospitals. Given this delay to the new hospital programme, will the Secretary of State commit to prioritising more social care packages now, rather than waiting 3 years for a review to be complete? And while we understand the Health Secretary is not responsible for inheriting the current state of the NHS or the current state of the economy, the new hospital programme was seen as part of the solution to NHS in crisis. And people across the sector have warned that delaying the new hospital programme will only mean more treatments cancelled and more money wasted on plugging holes in hospital buildings that are no longer fit for purpose. And so we're really concerned that one of the biggest announcements affecting the NHS over the next few years is coming out right now during Donald Trump's inauguration, because it will not get the attention and the media attention that it deserves. And so Liberal Democrats were urging the Health Secretary to promise to release a full impact assessment and how the delay to the new hospital programme will affect patients and NHS staff.
Taking those points in turn, I mean, firstly, with enormous respect for the momentous democratic event taking place in Washington today, I don't think that the new president, last time I checked, has declared an interest in any of our hospital schemes, and I'm sure will forgive us for getting on with the job of British government, even as the American handover takes place. I committed to come to the House in the new year some time ago. I have kept that promise, and I dare say the decisions that we are taking and setting out today will receive good coverage. I would also reassure him and other members across the House with an interest in particular schemes that my honourable friend the Minister and officials from the programme team will be happy to meet with members across the House as early as tomorrow to take questions on individual schemes. He raises broader challenges about the NHS and social care pressures in our country. That is why the Chancellor prioritised investment in our NHS and social care services in the budget, £26 billion of additional funding for my department for health and social care. And of course, on social care specifically, we've taken a number of actions in our first 6 months, from fair pay agreements for care professionals, the biggest expansion of carers allowance since the 1970s, an uplift in funding for local authorities, including specific ring-fence funding for social care, and we will be setting out further reforms throughout this year, as well as Phase 1 of the Casey Commission reporting next year for the duration of this Parliament. Look, members opposite can't have it both ways. They can't keep on welcoming the investment and opposing the means of raising it. If they don't support the Chancellor's budget, which is their democratic right, they have to say which services would they cut or which alternative taxes they would raise. Welcome to opposition, folks. We've been there. Enjoy the ride. You'll be there for some time. And finally, let me just say to the Liberal Democrats who've constructively raised a range of challenges. I mean, this is at the heart of the challenge facing this government, because he's right to mention the capital challenges facing the secondary care estate. The same is true of the primary care estate, the community and mental health estate, and as I spelled out, every single one of my cabinet colleagues also has significant capital pressures. That is the consequence of 14 years of underinvestment in our public infrastructure and in our public services, which means we are paying a hell of a lot more for their failure than we would have done had they built on, rather than demolished, Labour's record of the shortest waiting times and the highest patient satisfaction in history.